Hi everyone, this is Dr. Eyetemou Miguel, your pharmacist, and in this new video we are going to talk about calcium and cardiovascular disease. Does taking calcium increase your risk of developing cardiovascular diseases later on? That's a question we are going to answer, and I'm going to base this video on a recent study that was made on the topic. So let's talk a little bit about calcium and its presence and its roles, its functions in the body. Calcium is one of the most important minerals in the body. It has different roles. We all know that calcium is important for the bone's health, but calcium is also important for the nerves. It helps the nerve impulses to circulate, to go from neurons to neurons. It's also an important blood clotting factor, so it will prevent hemorrhage. It's also important for your muscles, for muscles contraction, and as the heart is also a muscle, it's important for your heart contraction, so your heart hurts. These are some of the main functions of calcium in the body. Calcium gets into your body either as a nutrient that you find in some foods, such as the dairy products, such as milk, or edible bones of some fish, fatty fish such as sardine, or leafy green vegetables. It can also come as a supplement. So a lot of people take calcium supplements to cope with certain health conditions, because calcium helps people with cramps, muscle cramps. Also, people suffer from osteoporosis, which is a condition in which your bones are weakened and they are more fragile and susceptible to be broken. And the people who are mostly concerned by osteoporosis are post-menopausal women. And also, calcium supplementation is strongly recommended and prescribed to pregnant women throughout their pregnancy. There's no problem if you take calcium from natural sources, from your foods, but there might be some concerns about calcium supplements that you take for certain health conditions. So the question is then asked, is the fact of taking calcium supplements going to increase your risk of developing cardiovascular diseases? And the study that I was talking about at the beginning of the video asked the question, and the results are not so positive for calcium supplements, because the study shows that people, mostly postmenopausal women who were taking 700 to 1000 milligrams of calcium supplements per day, had an increased risk of cardiovascular disease of 15% and an increased risk of coronary heart disease of 16%. Coronary heart diseases are conditions that affect the structure, the integrity, and the function of your coronary arteries, which are the blood vessels that supply your heart with blood. So if you are menopause and your doctor prescribes you calcium supplements, what should you do? Am I recommending you not to take calcium? No, that's not the point of this video, but to raise your awareness on the possible risks, yet limited and still to be searched for, to be studied, to be investigated. But you need to limit your calcium intake as a supplement. As we saw in the study, those people who took more than 700 milligrams per day had a little higher risk of developing cardiovascular disease. So you can limit your daily intake to 500 milligrams per day to avoid that kind of risk for your heart health. And if you have any other concern about calcium supplements, it would be better for you to talk with your physician to find a proper dosage for you, because you might have other health conditions that require you to take more than 500 milligrams of calcium per day. So thank you for having watched the video. Please do not forget to like the video, to subscribe, and to turn the notification bell on so that you are not going to miss my upcoming videos.